Hi and welcome to my channel. I'm Jane. I'm a dentist from Germany, and today's topic is gonna be about dental bleaching or tooth whitening. Recently on Instagram I asked you whether you want to hear more about dental bleaching or veneers. The majority of you decided to know more about dental bleaching, so here we are and let's go. Aligned, white and well-contoured teeth are very important to the majority of us. Dental bleaching is the first step in the reproduction of smile aesthetics. Naturally, it's a sign of health and well-being. Changes in tooth color is a common phenomenon. Tooth discoloration may have quite a few reasons. Certain types of medication may play a role, as well as bacterial plaque, the accumulation of bacterial plaque. Of course, there are more reasons, but what I want you to know is that there are external and internal discolorations. So let's focus on the external discolorations. These come from tobacco, coffee, tea, everything you get from the outside on top of your teeth. On the other hand, the intrinsic stains come from the inside. Either it's genetics, or because of medication, or because of dental treatments. So these are the more complicated ones to treat, and a dentist should be involved for sure. There are several bleaching techniques with different types of substances, such as carbamide peroxide and hydrogen peroxide in different concentrations. In addition to the variety of bleaching substances, light sources can be used in order to potentiate the bleaching action. Those can be ultraviolet, LED, or laser. So what are the adverse effects of dental bleaching? Isn't it dangerous? Doesn't it damage the teeth? The most common adverse effects associated with vital tooth whitening is tooth sensitivity. The incidence of hypersensitivity post-bleaching ranges from 10 to 90% of mild to moderate intensity. So if you have dental sensitivity already, you might reconsider bleaching your teeth. Although there are methods in order to neutralize dental sensitivity, tooth sensitivity remains a major concern. The reason behind that is simply that the potassium nitrate and the fluoride, although they are added to the bleaching agents, they result only in a very limited reduction of the tooth sensitivity. There are three ways in order to bleach your teeth externally. First, in-office bleaching. Second, the combination of in-office and home bleaching. And third, home bleaching. In-office bleaching offers the fastest but shortest results. The risk of tooth sensitivity post-treatment is increased. I usually don't recommend this method unless it's an emergency, like an upcoming wedding or a last-minute presentation. The reason behind that is that the dentists use such a high concentration of bleaching agents, which increase the risk of hypersensitivity post-treatment, and this is a very aggressive approach. So let's get to option number 2, the combination option. So basically the dentist creates an individual tray for your teeth and hands you the bleaching gel with the recommended concentration of active ingredients. This way the results last longer, and overall this method is more effective. But keep in mind, 2 weeks of duration are needed. As an example, here I have a tooth whitening kit. It is from Opalescence. It's called Opalescence Tooth Whitening System. It has 16% of carbamide peroxide with potassium nitrate and fluoride, which kind of neutralizes the tooth sensitivity. Anyways, you gotta talk to your dentist in order to get the right percentage of or right concentration of the bleaching gel. And this you cannot just buy at the drugstore or at the pharmacy, since the concentration is quite high. So make sure to go to the dentist and get everything from him, because it's the safest way to do it. So let's open it. And here you can see safety instructions first. Then you have a toothpaste here, a whitening toothpaste, in order to, you know, just help with the whitening process. And you have a little box for your individual trays. These are mine, as you can see here. And then You have these small syringes. As you can see, I used some of them already. This is the correct tooth whitening kit which you get from the dentist and only at the dentist. So don't think you can get that online or anywhere. And if you can, then don't do it, because you don't know what you're actually doing to your teeth. So just be very careful and go to the dentist, talk to him. So let's get to the third option, which is the home bleaching. Home bleaching is dental bleaching without any dentist involved. Since there is no dentist involved at all, it's the least effective way to bleach your teeth. Simply because the bleaching gels you can buy in drugstores or at the pharmacy are at such a low concentration, or they're not present at all, so they're not gonna do anything. Violet LED does work without gel, but very minimally. Like, the results of that are very limited. So reconsider buying those items on the internet. You probably lose more than gain. So these are the 3 treatment options you can use in order to bleach your teeth externally. Last but not least, stay away from home remedies. Actually, a warning must be given against cigar ash, lemon juice, strawberry juice, or baking powder. They all contain high concentrations of acids and or too many emery materials, which not only aggressively affect the tooth enamel, but also increase the susceptibility of tooth decay, which is caries. As we said in the previous episode, charcoal is not good for your teeth. Stay away from charcoal. If you didn't see that episode, go watch it after we finish here. For your oral and dental safety, stay away from home remedies, stay away from charcoal. Talk to your dentist about tooth whitening. You might have other dental conditions which only your dentist can diagnose and treat. If you liked today's episode, make sure to give this video a thumbs up and subscribe. Thank you for watching and see you next time. Bye!